All right, so today we're diving deep, really deep into the world of critical care.
Uh-huh.
We're talking about a device that can actually lend a helping hand to a failing heart.
Yeah.
It's called an intra-aortic balloon pump, or IABP.
Right.
And you sent us some really interesting research on it, so we're going to break it all down.
It's a fascinating device, really. It's been around for a while now, but it still kind of captures the imagination.
I bet. It sounds almost unbelievable, this whole idea.
It does, right.
But let's back up for a second.
Okay.
For our listeners who maybe aren't familiar, paint a picture for us.
So picture this.
Okay.
Your heart, the engine of your body, suddenly can't keep up. It's just not getting enough oxygen-rich blood
Yeah.
to all the places it needs to go, your organs.
Uh-huh.
And that is the scary reality of something called cardiogenic shock.
That's got to be terrifying for patients.
Oh, absolutely. And it can happen in a few different ways.
Yeah.
One of the most common is after someone has a heart attack, where there's a blockage. And that blockage cuts off blood flow to the heart muscle.
The heart isn't getting what it needs.
Exactly. The heart needs that blood. And
Yeah.
when it doesn't get it, that's a huge problem.
Right.
The other way is something called acute heart failure.
Okay.
And essentially what's happening there is, for various reasons, the heart just can't pump strongly enough to meet the body's demands. It's just not strong enough.
It's like the engine's worn out.
Yeah, in a sense, yeah.
So whether it's the sudden blockage or this more gradual wearing down, it's not good.
Not good at all.
The result is a heart in distress.
Exactly.
And that's where this IABP comes in, almost like a helping hand for a struggling heart.
Yeah, that's a great way to put it.
The research you sent actually uses this really interesting phrase. It calls the IABP a counterpulsation pump.
It does, yeah.
Now, I gotta ask, what does that even mean?
So think of it like this. There's this tiny balloon, and it's inserted into the aorta. That's the main artery that carries blood from your heart to the rest of your body.
Right.
And this balloon, it inflates and deflates, but it does it in sync with your heartbeat. It's pretty amazing.
So it's working with the heart, but how does that help? It seems too simple.
It really is all about the timing, honestly. So when your heart relaxes between beats, the IABP balloon inflates.
Okay.
And that gentle inflation, it pushes blood back towards the coronary arteries.
And those are the vessels that feed the heart muscle itself.
Exactly. It's like giving the heart its own little blood supply boost right when it needs it most.
So it's like a little extra squeeze of life for the heart muscle.
That's a great way to put it.
That's incredible.
It is pretty amazing. And then, right before your heart contracts to beat again, to pump the IABP balloon, it deflates rapidly.
Okay.
And when that happens, it creates this sort of vacuum effect, which reduces the pressure that the heart has to push against.
So it's clearing the path for the heart in a way.
Exactly. Making its job a little bit easier.
So the IABP is kind of doing double duty then.
Yeah.
It's improving the blood flow to the heart and also lightening the workload of the heart.
That's exactly right.
What kind of impact does that have on a patient?
Oh, it can be really significant. The research, dives into how IABP use, it can increase cardiac output.
Which is?
So that's the amount of blood the heart pumps every minute.
Yeah.
More blood pumping means more oxygen-rich blood circulating, and that means your vital organs have a better chance at recovering.
It's like giving the heart a break, a chance to catch its breath and regain some strength.
Yeah, exactly.
But like any medical intervention, I'm guessing there's some debate about when using an IABP is the right call.
You're absolutely right. It's not always a clear-cut decision.
Right.
And that's where, research like this is so important.
So it's not a one-size-fits-all solution.
Not at all. The heart's a complex organ.
That makes sense.
Yeah.
And it sounds like the research really highlights how important it is to tailor treatment, figure out what's causing the cardiogenic shock in the first place.
Absolutely. You got to understand the root of the problem.
It's amazing how medicine is always evolving. There's always something new to learn.
Always. Now, imagine this. You have a patient who's depending on this device.
Okay. Yeah.
And they need to be transported. That's where things get really interesting.
Okay. That's what I call high stakes. And the research actually talks about this critical care transport.
Yeah, it's a whole other ballgame. You're talking specialized equipment, planning. You got to make sure that patient is stable the entire time. It takes a highly specialized team to pull it off.
It's like a well-choreographed dance, almost. Everyone has to be in sync.
A very high-stakes dance.
Absolutely. And there are things you have to consider that most people wouldn't even think about. Like the research mentions altitude changes
Oh, yeah.
during air transport.
Huge factor.
That can actually impact how the IABP functions.
It's true. Even a small change in altitude can throw things off. It's all about pressure, you see.
So they have to account for that while they're up in the air.
Oh, absolutely. The medical team's constantly adjusting, making sure everything's calibrated just right.
Talk about pressure. And it's not just altitude, is it? There are so many other things they're monitoring for.
You're right, they're watching everything. Blood pressure, heart rhythm, any signs of bleeding or infection. It's a constant balancing act.
It sounds incredibly demanding.
Oh, it is.
And the timing of the IABP itself seems so crucial.
It is crucial, absolutely crucial. The tiniest error can have consequences.
So what are some of those potential issues? What are the warning signs they're looking out for?
Well, one thing is early inflation. So if the IABP inflates before the aortic valve closes,
And that's
it's a crucial valve in the heart. If it doesn't close properly, the blood flow can be obstructed.
it's like trying to close a door against a gust of wind.
Exactly. And then there's late deflation.
What happens there?
If the balloon doesn't deflate quickly enough, the heart has to work harder, which defeats the purpose of having the IABP in the first place.
It all comes back to that perfect timing.
It really does. It's like a dance, remember?
A very precise dance.
Exactly.
So we've talked about how the IABP works, its role in helping a heart that's in trouble. And we've even touched on some of the challenges of keeping it running smoothly, especially during transport. But before we go any further, why should this matter to our listener?
That's a great question. I think it highlights just how incredible medical science can be.
In what way?
We're talking about a device that can literally mean the difference between life or death. It's a reminder that even in really serious situations, like cardiogenic shock, there's hope.
It's really amazing to think that we can give a heart that's in trouble a little extra help with something like an IABP,
It is pretty remarkable.
especially during those moments when, every second counts.
Absolutely.
And we were just talking about the precision of the IABP, right?
Right.
And how it syncs up with the heartbeat.
Yeah.
But the research also mentions these different ways to trigger it.
It does, yeah.
It's not just as simple as, like, flipping a switch, is it?
Oh, not at all. It's way more sophisticated than that. The most common way is using the patient's EKG.
Okay, now hold on a second. Let's break that down for a moment. For those of us who aren't, fluent in medical jargon, what exactly is an EKG?
Good point.
Oh.
It stands for electrocardiogram, but EKG is easier to say.
Right.
It basically measures the electrical activity of your heart.
Okay.
Think of it as a really detailed heartbeat tracker.
Okay.
And the amazing thing is the IABP can actually use those signals, those electrical signals,
Yeah.
to time the inflations and deflations perfectly.
It's like it's listening to the heart's rhythm and adjusting itself.
Yeah, exactly.
That's wild. But what happens if the rhythm isn't regular, like in atrial fibrillation?
Ah, yes. You're getting into the nuances now.
Because that seems like it would throw things off.
Atrial fibrillation, it means the heart's upper chambers are kind of doing their own thing. They're not beating in sync with the lower chambers. So yeah, you end up with an irregular rhythm.
So does the IABP just, like, stop working? What happens?
No, it's smarter than that. That's where those different trigger modes come in. Remember we talked about those?
Right.
The research mentions something called, and get ready for this, atrial fibrillation trigger mode.
Okay.
It's basically a backup plan when the heart's rhythm isn't playing by the usual rules.
So even with that irregular rhythm, the IABP can still do its job.
Exactly. And there's even a pressure trigger option. So instead of relying on those electrical signals, the IABP can actually detect the pressure changes in the aorta directly.
It's like a backup to the backup.
Exactly. You got it.
Wow, so many layers of safety built in.
Right.
But like any complex equipment, things can still go wrong.
Of course. It's not foolproof.
So what happens if there's a malfunction? Especially during something like transport, where things are already high stakes.
Well, that's where the expertise of the medical team really becomes crucial.
Right.
They have to be able to troubleshoot, think on their feet.
So what kind of things are they looking out for?
Well, one of the most important things is listening for alarms.
What kind of alarms?
So one really critical one is a rapid gas loss alarm.
And what does that mean?
Could mean there's a leak in the system, or worst case scenario, the balloon itself has ruptured.
That sounds really serious.
Yeah, and especially if you're, thousands of feet in the air during a transport.
Great. What do they do?
That's where things get really tricky. They might have to switch to a backup system, maybe adjust medication, or even consider landing the aircraft as soon as possible.
So they have to make some really tough calls.
They do. Patient safety comes first.
Always. So it's not just about recognizing when something's wrong with the equipment, they also have to know how to fix it and fast.
And that's why their training is so intensive. They have to be able to identify and address any potential issues with the IABP, no matter what. And they have to be able to explain it clearly to the rest of the team.
Right, because communication is key in those situations.
Absolutely. Everyone needs to be on the same page.
So we've talked about equipment malfunctions, but what about those timing errors? Those seem just as important.
Oh, absolutely. Those can be really subtle, so they have to be extra vigilant.
So how do they even catch those if they're so subtle?
Well, they're looking at the pressure waveforms on the monitor,
Okay.
and they're trained to spot even the smallest discrepancies, just like a musician would notice a wrong note.
That's impressive.
And they're not just looking for the problem, they're figuring out how to correct it in real time.
So they're constantly analyzing and adjusting.
Precisely. And that requires a deep understanding of how the IABP interacts with, the whole cardiovascular system.
It's amazing how they can just process all of that information, especially when they're on the move with a critically ill patient.
Yeah, that's why these teams, they're the best of the best. They're dealing with a lot.
It's like they're playing a high-stakes game of, like, medical chess or something.
That's a great analogy. And remember, we talked about transport and how challenging that can be? Well, air transport with an IABP, that has its own unique set of challenges.
Oh, right, because we can't forget about those altitude changes.
Exactly. It's not like you can just put an IABP on autopilot.
Right, it's not that simple.
No, not at all. Although some models do have automatic altitude compensation features.
So they've built in some smarts to help the IABP adjust.
They have. It's pretty incredible what they can do these days.
It is.
But even with that, the medical team still has to be super vigilant. They need to understand how that specific model compensates for the altitude changes and be ready to make adjustments manually if they need to.
It's like a pilot monitoring the instruments. Even when the plane is on autopilot, you can't just assume everything's okay.
Exactly. You got it.
You have to stay sharp.
Absolutely. And it's not just altitude either. We're talking turbulence. They have to make sure everything's secure, that the patient's positioned correctly, and they also have to make sure they have enough helium.
Hold on, helium. Like, for balloons.
You got it. That's what
Yeah.
they use to inflate the IABP balloon.
Wow, I had no idea.
Yeah, you can't run out mid-flight, that's for sure.
No, I imagine not.
It's all about planning, anticipation, and thinking several steps ahead.
It's like packing for a long trip, but instead of clothes, you're packing medical equipment. And helium.
There you go. That's a good way to put it.
These critical care transport teams are amazing, though. They play such a vital role in getting those patients where they need to be.
They do. And making sure that life-saving care isn't interrupted for even a second.
It's pretty incredible when you think about it.
It really is. It's a seamless continuation of care, even in the midst of all that complexity. They are truly remarkable.
They are. So we've covered the inner workings of the IABP, we've talked about how those timing mechanisms work, and we've even gone into the complexities of critical care transport. What are some of the things you want our listeners to take away from all of this?
I think the biggest thing is to realize that even though cardiogenic shock, it's a very serious condition, it's not insurmountable.
Right.
There's hope. And we have these incredible technologies like the IABP and incredibly dedicated medical professionals who are out there fighting for these patients every day.
It's a powerful reminder that even in the face of these really scary illnesses, we have brilliant minds working tirelessly to find solutions and improve the odds.
Exactly. And speaking of improving odds, let's talk about the future of IABP technology.
Okay.
There are some really exciting things on the horizon.
It's really amazing to think how far we've come in treating these serious heart conditions. But, as we're looking at this research, it really highlights that it's not just about the IABP itself.
Right.
It's also about the decisions that we're making, when it comes to these life-saving interventions.
You've hit the nail on the head. When you have a device that can literally make the difference between life or death, you're going to have some ethical considerations. You have to.
Right. Like, where do we draw the line?
Exactly.
When is it appropriate to use it? When is it maybe time to look at other options? And how are those decisions being made?
It's not always easy. It's a delicate balance, for sure.
Yeah, I bet. And it sounds like, the research doesn't always give us these clear-cut answers.
It doesn't. We don't always have all the answers. Medicine's not perfect.
Right. So how do medical teams navigate that? Because it seems like a lot of pressure, weighing those potential benefits against the risks.
Well, that's where communication is key.
Okay.
You've got to have those open and honest conversations with the patients, with their families, and with the whole medical team. Everyone needs to be on the same page.
It's a good reminder that even with all this incredible technology, medicine is still very much about people.
It is. At the end of the day, it's about people.
So, as we wrap up our deep dive here into the world of IABPs and cardiogenic shock, is there one, like, thought-provoking question you would want to leave our listeners with?
Ooh, that's a good one. Okay, let me think. Oh, I know. I would ask them to imagine that they're the inventor,
Okay.
and they've been tasked with creating the next generation of heart support devices.
Hmm.
What would that look like?
Oh,
What would they
wow.
focus on? Would they try to make the IABP even smaller, even
Yeah.
smarter? Or would they, like, go in a completely different direction and look at things like regenerating damaged heart tissue?
That's a great question. It really makes you think about the future and what's possible.
Exactly.
Well, on that note, thank you so much for joining me for this deep dive. It's been fascinating.
It's been my pleasure. This has been a lot of fun.
And to our listeners, thank you for joining us. We'll see you next time for another deep dive.